We have a nice mixture at our PRC of clinicians and social scientists. I think in particular economists and psychologists. It fits a bit the strengths of the faculty at the University of Pennsylvania in behavioral economics, which is a mixture of economics and psychology, where collectively we're trying to move the field forward in terms of understanding how those insights can be applied in terms of improving health and health behavior.
So understanding where people are in their health behaviors and how to move them by creating messages that speak to their interests, that's where prevention research works in my world.
And so a great thrill has been learning new methods like work with Dr. Jordan on this messaging project using the theory of reasoned action to apply rigorous quantitative and qualitative methods to identify exactly what are the right words to say to people to motivate a behavior. Really using the skill of a focus group in a way that gets you really good concrete data together with the empirical data you've gathered to arrive at a solid conclusion about whether what you've discovered is going to work or not.
As a medical anthropologist, I understand culture and I understand context and how important understanding culture and context and environment is in health. Some of the methods that I bring are more ethnographic or qualitative types of methods, trying to understand how people actually experiencing a phenomenon are thinking about it.
I was trained as a social epidemiologist, and really in social epidemiology, often we think of certain kinds of information as good data. We think about survey data, we think about cohort studies, we think really in quantitative terms often. What I've learned in doing community-based participatory research is that it's absolutely critical that I get up out of my chair, that I go out of my office, and that I talk to people in the community to really understand what they need, what they want, how they hurt, what they hope for. Because at its core, those are really the things that motivate me to do my work.
Health behavior change tends to be a fairly interdisciplinary field. There are economists who are thinking about this from the standpoint of incentives and ways of giving people feedback that can be helpful. A lot of psychologists, a lot of other social scientists really are focusing on developing novel strategies for trying to help people change behavior. What's exciting about this is in many cases we see interdisciplinary teams coming together where they're trying to take theories and other approaches that have been empirically tested separately in different contexts and trying to bring them together to see if we collectively can come up with strategies that are more effective.
The key feature that I look for in a collaborator is real curiosity about human beings and the human experience. I want to work with people who want to know more. I want to work with people who could talk to someone in an elevator and say, you know, tell me how your day is going, and then really care about the answer. So I think that's one of my biggest bits of advice for people who are interested in community-engaged research, is just to truly bring your sense of caring and your sense of curiosity into any interaction, because there's so much to learn in every interaction.